Did you know that 33 million teen vapers globally think that because e-cigarettes don't cause cancer, like conventional cigarettes, they must be all good? By conveying the hazards of nicotine vaping as 5-minute short stories or microlearning, and spoken in the simplest language possible, Safeguard is by youth, for youth, and in the language of youth. Teen Vaping Awareness Mission. So, what are you waiting for? Listen, learn, quit.
Hello everyone, and welcome back to the Teen Vaping Awareness Microlearning platform, Safeguard, where I seek to take the complex science of teen vaping and simplify it down to an adolescent-appropriate level. So now we're on story 8 of our 9-video microlearning series, and we've come a very long way since story 1, where we discussed the history of smoking and the invention of the e-cigarette by Honlick in 2003. We then journeyed into story 2, discussing the differences between smoking and vaping, before doing that organ-by-organ analysis of the medical hazards of vaping in story 3. Story 4 then delved into the corporate tactics that lure minors to e-cigarettes, with story 5 highlighting the global and US prevalence and the epidemiology of teen vaping. Story 6 delved into the social triggers or social determinants that drive teens towards vaping, and our most recent microlearning video, story 7, discussed the anti-vaping legislation brought forward by the US government. So now we're on story 8, which refers to the R of Safeguard, which refers to research into vaping cessation medications. So why do we do research in the first place, you may ask? One major reason is so that we have FDA-approved medications for people to use. And in that light, many addictions, as we'll see in the next slide, have approved medicines for treatment. So why isn't there an FDA-approved drug for vaping? So that's one question we'll unpack today. And another thing that we'll unpack is we'll discuss cytisinicline, which is the world's first drug therapy, which is currently in development for vaping. So, many addictions with very high prevalences have FDA-approved treatments. As you can see here, drinking, opioid usage, and tobacco smoking of conventional cigarettes with prevalences of 36.1 and 28 million people above 12 years of age, respectively. All of these three have multiple FDA-approved treatments, and some of them are oral, some of them are injectable. Vaping, on the other hand, despite having 11 million teens and young adults who actually do vape, have no treatments approved by the FDA whatsoever. Why is this, you may ask? One reason is because the nicotine vape device was invented only 22 years ago, in 2003, and it only became popular around 2011, 10 to 15 years ago. And hence, the clinical development of medication for vaping cessation cannot possibly be compared to smoking, which has been prevalent for over 200 years, as we saw in story 1. But the vaping epidemiology is alarming. In just 10 to 15 years since launch, it has 11 million users in the US, whereas in the whole 200 years of conventional smoking, it's only gained 28 million US users. The other thing to consider when analyzing why nothing's approved for e-cigarette vaping is the question of whether or not smoking and vaping are the same or similar addictions, to the point that smoking cessation products can interchangeably be used in vaping. And the FDA to this says no. They say that the kinetics of purified nicotine, and as we were talking about in story 3, or story 2, I believe, that the purified nicotine molecules in a vape device compared to the more crude nicotine in a conventional cigarette device, the purified molecules can penetrate the lungs much more deeply than crude tobacco. And hence, the ability of purified nicotine to harm organ systems is very different from the ability of the crude nicotine in smoking. And hence, a true nicotine vaping product has to be officially approved by the FDA, and smoking products shouldn't simply be used off-label for vaping. So now to go back to our trusty National Youth Tobacco Survey that we've been referencing throughout the microlearning series, I've always said how the NYTS is one of the most authoritative data sources we have regarding vaping, so here it is again. So the good news is that even as 1.63 million teens in the US vaped in 2024, the 2021 survey has shown us that almost 2/3, or 65.3% of all teens, had the will. They were thinking seriously about quitting e-cigarette usage, and when there's a will, there's a way. But the bad news is that the same year's survey showed 60.2% of people stopping using tobacco products for a day or longer, but then resuming. This begs the question of whether or not we can create a just right medical intervention for vaping. Such an intervention would need to be oral, fast acting, and that it can have an onset within 24 to 48 hours to prevent people from stopping using tobacco products but then resuming. It would need to have sustained efficacy for 6 months or more, and it would also need to have low side effects. So now I wanted you to get a little bit into the neuroscience of this and into what's called the reward pathway. This is something that we also talked about in story 3 in that organ by organ analysis that we did there, but just wanted to sort of recap to you what happens. That when we sort of inhale purified nicotine in a vape situation, it crosses the blood-brain barrier and it binds to a nicotinic receptor. This later sends a signal to the ventral tegmental area, or the VTA, which you can see in purple here, to make dopamine. And all of these areas over here, all of these brain regions, which are part of the reward system or the reward pathway, sort of together sort of say, this is good, let's do it again. And that sort of leads to the repeating cycle of vaping, which eventually leads to addiction. So, what we need to do in order to actually engineer a drug to mitigate vaping is to try to outsmart the reward pathway. So there are many ways we can do this. We can prevent nicotine from binding to its nicotinic receptor in the first place, or we can stop the process downstream as well by preventing signaling to the VTA or preventing the creation of dopamine. There are many things we can do here that can actually start to outsmart the reward pathway. But let's start at the very beginning with actually preventing nicotine from binding to its nicotinic receptor. So there's actually a treatment, as I was saying in the beginning, that actually tries to do this, which is referred to as cytisinicline. So here you can see cytisinicline, and we don't need to be fancy organic chemists in order to look at these two molecules, at nicotine and at cytisinicline, and to see that they're actually quite similar in terms of their actual structure, in terms of their actual composition. So what Achieve Life Sciences, which is the biotechnology company that created cytisinicline, was actually able to do is they've created this product that's able to actually fool the receptors and actually able to mimic nicotine and bind to nicotine's receptors. And when cytisinicline does this, when cytisinicline sort of takes nicotine's place, if you will, with these receptors, takes its spot, this prevents any signals from being sent to the VTA and sort of prevents this sort of vicious cycle of the reward pathway from continuing. And this is sort of why cytisinicline could be successful in sort of curbing teen vaping, or definitely in outsmarting the reward pathway. So, what has Achieve Life Science achieved in terms of the stats of cytisinicline? So, subjects treated with it, you can see here, were over twice more likely to show continuous abstinence compared to people treated with a placebo product, and this was also referred to as something called statistically significant, and that it's a reproducible result. It's not just the result of a fluke or sort of an accident. It's sort of a purposeful, reproducible result, and that's what is demonstrated here, which sort of demonstrates how successful cytisinicline has been in past trials. But now a phase 3 clinical trial, this was a phase 2 trial, a phase 3 trial for cytisinicline in vaping is expected to start in 2026. But a major question I wanted to leave you with today is whether or not this trial will include adolescents, will include teens. I really hope it does, given how we've discussed how teens are such a big part, such an integral part of the vaping epidemic in the first place. But there are many challenges from these companies' perspectives in including teens in terms of like other commitments, ability to sort of commit to the trial, etc., being in school. So this has sort of been a barrier to inclusion of teens in these types of trials in the past, but I really hope that as cytisinicline and the research surrounding cytisinicline sort of continues, they'll be able to include teens in this phase 3 vaping trial. So, as usual, we'll conclude with our learning objectives quiz. Here are your 5 questions for the day. What are 3 addictions for which there are FDA-approved drugs? What's the FDA's position in getting new drugs approved strictly for vaping? Per the NYTS, which of these statements are not true? Biologically speaking, what are all ways for medicines to block the nicotine reward pathway? And what is cytisinicline? So we'll give you the opportunity to pause the video and answer through all 5 of these questions, and then we'll circle back to discuss the answers. Okay then, I hope you've all had the opportunity to pause the video and attempt all 5 of the questions. Now let's look at the answer key. So here are the answers to all 5 of these questions. I'll give you the opportunity to check your work for these 5. And as usual, if you got 3 out of the 5 correct, thank you so much for tuning in today, and come journey with me to the final of our 9 microlearning videos as part of the Safeguard series. Thank you so much.